Thank you, Chairman. I wouldn't want to be the only person on the panel that didn't mention bases in our state. I know you both visited Fort Leonard Wood within the last year or so, and I'd suggest again that's one of the locations we have, and there are a few others, but there's no energy problem, there's no water availability problem, there's no environmental problem, there's no encroachment problem. We did have a hearing, as Senator Moran mentioned, that they had of the SPEA group. The governor was there, I was there, Senator McCaskill, who serves on the Armed Services Committee, was there, Congresswoman Hartzler, who serves on Armed Services in the House, was there. In addition, there were 2,000 people at Nutter Fieldhouse, and they had an overflow facility that they put people in who could listen to that hearing. You've both been there. You know the incredible community support for that facility, and I'm not sure there's a turnout that compares to that. I was told by the person who conducted the that session that there had been 11,000 emails regarding these various sessions, and over 4,000 of them came from the Fort Leonard Wood community, and having been there, you wouldn't be surprised by that. General, there's one question I do have that relates specifically to the fort. I don't think we told you that question was coming, so you may want to take it for the record. But the Surgeon General last year, when I was serving on the Armed Services Committee, said that the #1 medical priority for the military was on MILCON was hospital at Fort Leonard Wood. It then went off the FIDEP for 15. It's not on the FIDEP for 16. Serves that facility, also serves quite a bit of the community. Last upgrade there was about 40 years ago. You know, at least a year ago, the Surgeon General for the Army was still saying this was the #1 priority for medical facilities. And if you want to respond to that.
I would just say it remains very high on our priority list. The bottom line is our MILCON budget, because of the reduced dollars, we had to take risk. And so that's one of the areas we have taken risk. And it is still a priority for us to get an upgraded medical facility at Fort Leonard Wood. The problem is we simply don't have the dollars to do that right now. And we understand the fact that it is in great need. And so as the Surgeon General has stated, it's clearly her top priority. And so as we go forward, we had to choose where we took risk, and that was one of the places we decided to take risk. And it's not a good area. And frankly, it's one of those very difficult decisions we have to make.
It was precisely that, as the Chief said, Senator, a MILCON, MILCON cut that caused us to have to realign not just that facility, but a number of others. It's not a place that we particularly enjoy taking risks for obvious reasons, but if you talk to some of your colleagues, we have other hospital projects that have been similarly delayed that we want to get to as soon as we can. But as I know you understand, it's a product of money available.
Right. While talking about medical, I will say something I know both of you are supportive of, and I've been really active of at that same hearing. I asked the Surgeon General of the Army, said based on the NIH view that 1 out of 4 adult Americans has a mental health issue, diagnosable and almost always treatable, would that be different in the military? And her answer was no. She said, we recruit from the general population. We don't have any reason to believe that that same impact is not in the military. And whatever we can do to continue to move as we are moving mental health into the area of all other physical health. So it's treated the same way, expensed the same way, available to dependents and retirees the same way. And I know you're both supportive of that.
We are dedicating significant resources, particularly in hiring behavioral health specialists. When I first came to this job nearly 6 years ago, our stated requirement for those professionals was about 2,300. It's now over 5,500. We're about 85% of that fill. The reason for that growth is that we have begun to recognize, as we should, that the need for these kinds of providers is absolutely essential. So we've embedded behavioral health specialists at the brigade level. We've tried to get the care delivery system further disposed out through our ranks. And I would say as well, another part of it is the destigmatizing the reaching out for help.
Right.
There's a certain attitude in the military that you just pull yourself up by your bootstraps, number one, and number two, that if you do get help, somehow that'll hurt your career. We have worked hard to make it easier for soldiers to reach out for mental health care. And if you look at the number of help-seeking activities that have occurred, they have grown astronomically, as they should. That's what we want. And I think we're getting there, but it's been a long fight, and it'll be a long fight yet to go, given, as the Surgeon General and you noted in your data, the very widespread nature of these challenges.